Welcome class to another video about prenatal development. In this section, we are going to discuss a few things, but the first thing that we are going to discuss is brain development. Brain development occurs during the second trimester. It is during this time where we have neurons, and neurons move to specific locations, and those locations create different levels and regions of the brain. So really during the first two trimesters is when the basic brain architecture is formed. And the main thing that is developed during the second trimester is something called the neural tube. And the neural tube is this long, hollow tube, and that is located in the embryo's back, and that forms during the ectoderm, in the ectoderm of the embryo. So if you think about, okay, there's a long hollow tube located in the back, that is going to form the nervous system. And so the embryo's long hollow tube that is in the back of the embryo is the neural tube. It usually forms around 18 to 24 days after conception, and it usually closes after 24 days after conception. Usually when the neural tube does not form at the appropriate time, or when it does not close at the appropriate time, then that is when we have issues with brain development. But usually the neural tube forms around 18 to 24 days, and then it usually closes after 24 days of conception. Next, we are going to talk about teratogens and hazards to prenatal development. A lot of births are usually normal and the fetus and the embryo develop fine during prenatal development, but sometimes there are things that occur that can harm the fetus and the embryo during prenatal development. So that's what we're going to get into in this next section. The first thing that we're going to talk about is fetal alcohol spectrum disorder. This occurs when mothers are pregnant, and while they are pregnant, they drink alcohol heavily. And this is not a good thing for the fetus. And what happens in the womb is going to affect the prenatal development of the fetus, and it's also going to affect eventually what happens to the fetus or the baby after it is born. So there are a few symptoms of fetal alcohol spectrum disorder. They may have some facial deformities. They can even have defective hearts or certain body parts. And they also may have learning problems. And so when we think about fetal alcohol spectrum disorder, we understand that mothers that drink alcohol heavily, that has a negative impact on the development of the prenatal development of their child. And so alcohol in fetal alcohol spectrum disorder is an example of a teratogen. And a teratogen is just anything that can negatively impact the outcome of a child, and that could include cognitive or behavioral outcomes. Other examples could include nutritional deficiencies and maternal stress. Those, and also drugs, as we talked about alcohol and it being used as a drug, cocaine, all of those things will be examples of teratogens because they negatively impact children during prenatal development, and ultimately, if the child is born, that those teratogens will impact the child throughout their life. I want you to all to think about this word teratogen, and that comes from the Greek word terra, comes from the Greek word meaning monster. So obviously, if you're a monster, you're going to terrorize and cause harm to whatever is in your way. So that's exactly what a teratogen does. It causes harm to a child. There are certain principles of teratology that need to be addressed in this class, and the first principle is dose. That is important because the more exposure that the child has to the teratogen, then the greater the effect. Usually if if the child does not have as much exposure, the effect won't be as harsh, but the higher the dose of the teratogen, the greater the effect is going to be on the child. Additionally, we have something called genetic susceptibility. In genetic susceptibility, we're mainly focusing on genes. And when we are talking about genes, I mean, the genes we talked about in regards to nature, when we talk about nature versus nurture, the genes of the mother and the child directly influence the effect of the teratogen. So you may have genes that are just more susceptible to being to the teratogens, and that may cause even greater harm. But you may have more different types of genes or cells that are more resilient when they come in contact with teratogens, and because of that, then the effect might not be as much because you may have genes that are more resilient. So it really depends on the genes and how they act in the presence of teratogens. Additionally, the time of exposure is important. And when we talk about the timing of the exposure, usually the earlier that the embryo or the fetus or the cells during the germinal period are exposed, the more likely that the effect is going to be greater. So thinking about the germinal period, if a mother drinks a lot of alcohol during the germinal period, that may cause the cells may cause the egg, the fertilized egg, which is the zygote, to not even attach to the uterine wall. And so the zygote doesn't make it into the embryonic period or the fetal period. Additionally, if a mother drinks alcohol during the embryonic period, the child is going to be more vulnerable during the embryonic period compared to the fetal period, and therefore that may cause more damage because the embryonic period occurs before the fetal period. Another teratogen that a lot of people may not think about is the maternal diet and nutrition. Maternal diet and nutrition is very important. Mothers have to make sure that the child is getting enough nutrients so that the child develops appropriately and according to what we're learning in child development. Some children may be born to malnourished mothers. If you all watch This Is Us, which I do, an example of that would be Madison. She's a character and she's currently pregnant, but she also has an eating disorder. And she says that she has to remind herself to eat so that the children are she's having twins, so that the twins are getting the nutrients that they need. And that's important because children that have malnourished mothers, that means the child is also malnourished. And so that means that the child is more likely to be malformed. Another aspect of maternal diet and nutrition is looking at the weight of mothers during pregnancy. So we talked about being malnourished or being underweight. So let's go on the flip side and let's talk about being overweight. The embryo and the fetus can also be at risk if the mother is overweight. Something that occurs during pregnancy where a mother may be overweight is hypertension. And hypertension is very dangerous when a mother is pregnant with a child. So you want to keep that in mind as well. An important nutrition that or important vitamin that is very vital for normal prenatal development is folic acid. And so if you're a mom or you're expecting, or if you know parents, you may have family and friends that are expecting, you may check on them and even buy them food that is high in folic acid, because folic acid is really important to normal prenatal development. Maternal stress can also be an example of a teratogen. Mothers that are severely stressed during their pregnancy, that runs the risk of children having physical defects. The mothers may even have higher rates of miscarriage, and the child can be born with a low birth rate. So that is very important to understand and know that when someone is pregnant, obviously they have various day-to-day stresses, but if they are severely stressed, that is going to impact not only the mother, but also the child. Okay, I'm going to see you all on the next video, and we're going to talk more about birth rate in the next video. See ya.